Austin. Now researchers have developed a test that detects cancer long before the first symptoms appear. Here to talk more about that is Dr. Rebecca Wiatrek. She is a surgical oncologist with Texas Oncology who practices at St. David's Medical Center. This is pretty amazing technology we've got going here. Tell me a little bit about how this test actually works.
So before, we were always able to look at DNA that was circulating in the blood, but only when we knew what sort of cancer a patient had. So now this is taking and looking at over 30,000 mutations that are in the DNA that cancer sheds as it's dying off or as it's growing, and able to kind of look at more cancers in a screening way, whereas before you had to know you had cancer before you could test your blood.
Okay, so this would help too in preventative measures.
Most definitely. So the most exciting thing about this is if you could look at the blood and try to figure out in an early way when the patient had cancer, it would help us screen for some of the most common cancers that we have.
And early detection is very helpful.
Early detection is actually key at being able to cure the cancer.
Okay, so tell us a little bit about how much do these tests actually cost?
So these tests are actually pretty expensive right now, and we're not using them specifically in the office yet, but I think you can get them online, and it costs quite a bit of money at this point in time and may not be as accurate as you would like it to be.
Okay, so how accurate, what would you say the accuracy rate is?
That's the one thing that we're still waiting on testing for. So right now they've only tested about 150 patients, and in those they saw about 60% of the early stage cancers. And so when you're looking for a test that finds them, you want them to find way more than the 60%. You wouldn't want to be in the 40% that you missed it and felt reassured that you had found your cancer.
Okay, but 60%, that's still pretty good, and I'm sure
that is the best that it's done. Yes.
It's improving as you guys keep doing more research.
Correct. It is improving, and I think they're working on that. And the only way to prove that you have gotten all of those cancers is to take in more patients and look at and starting with the patients that already have cancer and then testing to see how accurate it is at detecting that. The problem is right now the way we find cancer, for most things it can be further advanced except for in breast or colon. Actually a colonoscopy can find precancer just like mammograms can find precancer, and you would assume that those cancers are not shedding cells. So we still have to figure out that disconnect.
But pretty amazing that you guys have figured that out
yes.
with the blood test.
The blood test is actually quite amazing, and I think it's more the technology at being able to test for that many mutations in that short a time that makes it really feasible to do, which could never have been done before.
Okay, so I know you said it's not going to be in offices quite yet, but how long are we thinking here?
I mean, I think if they're moving at the rate they're going in the next 5 to 10 years, we may be changing how we screen patients for cancer. And I think you have to also be cautious about doing that before you know what to do with the information. I have patients now who will get online DNA tests and say, look what I got, I have this, but we don't know what to test for, what to look for, if we're worried about cancer, so sometimes it can create more anxiety than it really needs to, or more tests.
Those are kind of be overwhelming when you get a lot of information that you don't know how to take.
Correct. So we're waiting to know what to do with it before
Okay, but very, very interesting. Is there anywhere someone can look for more information? We'll go to do you have a website?
We do have a website for Texas Oncology, and I would also recommend patients always go to the National, like American Cancer Society, National Cancer Institute. They always have up-to-date information on what the newest research is, clinical trials, and what the screenings are right now for patients, which is still your mammograms, colonoscopies, and so don't skip those waiting for this. Don't wait 5 years.
Okay, very good. Thank you so much for joining us, and stay with us. We have more Good Day Austin to come.